Well, hi everyone, and welcome back to Pushing the Limits. Today, I have Dr. Kal Fried with me, sitting in Melbourne, I believe. Is that right?
That's correct. Sunny Melbourne. It's sunny at the moment.
Sunny in Melbourne, and we've just been commiserating over lockdowns because we're in a level 4, and Dr. Kal said you've been in and out of one for the last year, so you guys have had it rougher than we have. That's for sure. How are you doing over there at the moment?
Look, I'm personally doing okay. I'm fully vaccinated, and I sort of I'm okay with work and things like that. But there are people really struggling, so I'm mindful of them.
Yes, absolutely. It's a hard time for many people. Now, today we're going to be diving into the topic of pain. And you might think, oh, that doesn't sound like a very fun topic, but it's a very important topic. And I wanted to learn from you today because you're an expert in pain. You've got an exercise and you're a medical practitioner, but you've had a focus on exercise science, I believe, and all of that sort of stuff. But you've gone really deep into the world of understanding pain. Can you just give us a little bit of a synopsis on your career and what you've done to date?
Yeah, just a brief idea of my background. I'm we call a sports and exercise physician. In fact, the college spans across Australia and New Zealand. There's some terrific practitioners down in your part of the world as well.
Mm-hmm.
So I was very much involved in looking after the medical needs of athletes, and then in my clinic I'd just see regular people who played sport and people who didn't play sport, just who got injured and had pain. I look at that was fantastic. I enjoyed that immensely, but I suppose there was always this nagging question that I struggle with, and that's that it was rarely the injury that really predicted the outcome. You could get very minor injuries with really terrible outcomes, and you get really amazingly terrible injuries with good outcomes. And so I couldn't quite figure that out, and I didn't feel comfortable with a lot of that. And fortunately, I was exposed to an area of science which wasn't really taught when I was in medical school. If it was, I was asleep in that lecture. But then if I was asleep, a lot of other people were asleep too, because it seems that very few people of my vintage sort of figured that out as well. So, and that's the science of pain itself and how it all works. And once you delve into that, it really starts answering a lot of these questions. And it's like a rabbit hole. You keep going, and the more you go, the more fascinating it becomes. We've got a lot more to learn, but some of the fundamentals of that science really start to explain the things that I couldn't understand, and that was good. That led me on a journey. I'm involved with this group now called the Pain Revolution. It's behind me, the emblem.
Mm-hmm.
And I urge people to have a look at that website because it pretty much encapsulates where I am these days.
Fantastic. So we'll put that in the show notes. So painrevolution.com.au, I'm presuming?
No, painrevolution.org.
.org. Okay, we'll put that, make sure that the team get that right. Okay, so let's dive into this a little bit. So a lot of people have an injury, for the want of a better example, they get a sore back, or they've injured themselves while lifting something or playing sport. Why is it just not a mechanical thing? Like, we think that pain is caused by a structural damage, in which it is in many cases, but why is that a bit of a simplistic look at pain? Is it a bit more complicated than that?
Look, it's complicated. It's certainly very complex, but it's also, the fundamentals are actually quite simple. But they're hard to get your head around because we don't grow up thinking this way. We grow up thinking exactly the way that you just mentioned, that pain is a mechanical thing. It's created by injuries and damage to our bodies, things we see on scans, but that's not actually the case. The fundamentals are quite simple, that our bodies do not produce pain ever. And I'm not just talking about injuries, I'm talking about headaches, stomach pain, all sorts of things. It's the body only ever produces electrical signals, and these signals get picked up by sensory nerves, and these signals get transmitted through the spinal cord to the brain, and then the brain lights up in all sorts of different interesting ways because of a lot of preconceived ideas and contextual influences and sociological influences, and you get a pain response depending essentially on how much danger your brain thinks you're in.
Wow.
So this is a protective system. This is designed to protect us, and you know it can be quite proportional to the injury you have, but it's not always proportionate, and sometimes it's very disproportionate. And we can all think of examples like that. Anyone who has had involvement with football teams or sporting teams will know that anyone who watches the Tour de France will know that people have these horrendous injuries. And at that level, they probably don't get enough pain for their protective needs because they keep going. And then on the other end of the spectrum, there's, you know, the situation where you just have a minor lifting injury. It can be just a bending event, and that sets you up for pain for the rest of your life. And we know people like that. They're quite common, unfortunately. And there's everything in between. So it's a spectrum. So I like to think of pain in terms of not causes, but contributors. So the physical side is important. It's not that it's not important. It's just it's only one contribution of many. And that applies equally for acute pain, like when you break a leg, or for chronic pain. In acute pain, if you've broken your leg but a car's about to run you over, you'll get up and probably walk away without feeling that leg for a little while.
Wow. And
there's some examples of that. There's two people who've had to, you can look these people up on the internet. One of them turned into a book and a movie for people who've cut their arms off to save their lives.
Yes, I know the story.
Yeah, there's another one actually. He was in the cellar of his house and he couldn't get help. And both of them say exactly the same thing, and that's that they were amazed how little pain they got.
Wow.
Now think of this, they're cutting through muscles, nerves, bones, and because they were in a survival context, their brains essentially shut out a large amount of that pain because it wasn't in their survival interest. And that's essentially how pain works. So there's these extreme examples that we can learn from, but really if you then apply them to the everyday examples that we see all the time, it starts to make sense. Things start to to sort of fit into place.
That's really fascinating. I had a Richard Little, he's the founder of a company called xsurgo.com, and this is he's an engineer, but the company is working on computer brain interfaces, if you like, that help with pain modulation. And so this is a really cool piece of technology that's not yet on the market, but he's bringing that to market in the next year or so. And it's looking at training your brain to not feel the pain anymore. I'm probably butchering his description of it, but basically you're playing a video game, and it's reinforcing all the things that do to stop the pain.
Yeah.
So it's reinforcing all these neural pathways in your brain to actually stop you experiencing it, and it's rewarding the behaviors that lessen the pain, from what I understand. So in other words, it's not just, it is very much about how we understand it. I also heard a story of a man who was in a construction site, fell off a first floor or something, hit the ground, and a nail went up right through his boot. Do you know that story? I bet you do.
Yeah, that's a story that was written up in a medical journal quite a long time ago, and there's a photo from that actual event of the nail in the boot. I use it in talks, and it does the rounds quite a lot.
Yeah.
And essentially, do you want to tell the story?
No, you tell the story. You'll be better at it.
Essentially, what happened was when this fella fell, the nail went through his boot, and he was howling in agony and had to be given. He was taken to the emergency department. He had to be given all sorts of really strong medication just to take the boot off. And when they took the boot off, they found that the nail hadn't in fact gone through his foot. It had just sort of gone in between his toes.
Wow.
And so the visual sort of contribution in that case was huge, and this person was in extraordinary pain. But once obviously he realized that the danger wasn't what he thought it was, everything settled down quite quickly. There's actually another I call it the tale of two nails, because there's another interesting nail story that was written up in a magazine somewhere, and it was a fellow who was operating a nail gun,
Mhm.
And the nail gun went off suddenly, and he got a bit of a fright, but he looked around, he couldn't see anything wrong, so he just kept going. He kept going for a week. He kept working, and he went to his dentist because he had a bit of a toothache. And when they took an X-ray, the nail that he thought had just gone off somewhere had gone up through his palate into the front of his
Oh my God.
into the front of his face.
And he
And
hadn't
so
felt it because he wasn't aware of it.
exactly, because there wasn't that awareness, he didn't get enough pain for his situation, I suppose.
Wow. So these are, two opposite sides of the spectrum here. And people probably thinking, oh, well, that guy was just a tough ass and the other guy was probably a wimp. But it's a bit more complicated than that, isn't it? There is
Yeah. Yeah, I don't like that conversation of
no.
pain thresholds and people being soft or weak. I've seen some, I've seen some situations involving people who were elite athletes, but the circumstances of their lives changed, and I suppose it's a bit like cricket. Sometimes you just have to get the timing right, and the ball sails over the fence. So yeah, I mean, you can just have a few things going on in your life that are perhaps affecting you that you're not aware of, even some stresses, some fatigues. Now with COVID times, I suspect this is going to probably result in some serious persistent pain, contribution over the next period of time, because everyone's under so much stress. I think it's just it's contextual. It's got very much to do with our beliefs and our expectations. I just I think it's just important to understand this stuff. You mentioned before about some of the technological advances. There's some fantastic things going on, but what we found is by just getting people to conceptualize their pain properly, we can make a difference.
Yep. And to be able to understand where it's coming from and taking control of some of those pathways. Because, my background is an ultra marathon runner. So, doing extreme endurance races for 25 years. And people seem to think that you have a really high pain threshold. Yeah. And while that may be true in some aspects, in other aspects, I'm a complete, can't handle it, can't handle the pain. And so there's different types. And I think you're right on the money when you say, like, the times when I've been in even more pain than I could cope with have also been times when I've been under a hell of a lot of stress and would have a lot less resilience for whatever reason, because I'm dealing with a whole lot of stuff going on or something's happening. And then your perception, I mean, women will know this at different times in the cycle. They're more likely to be, feel a bit more vulnerable and a bit weaker and a bit more teary and a bit more prone to feeling more pain than in other times of the month. Is that a thing? Is that a are we very much susceptible to all of the inputs in our environment and not just the actual, the nail going through the boot in this case, or,
Yeah, look, that's definitely a thing. I think the best model I think exists for understanding pain is that any time we feel pain, and for that matter, all the sensations we feel, which are essentially produced by our brains, there's a lot of things going on at the same time. Some are recognizable and some are not recognizable. There's a hell of a lot that are under the surface that we really can't even perhaps recognize or acknowledge. So I think you can make it so complex that it's almost a bit scary. But I think just accepting that there are lots of things involved, I think helps a lot. I know personal experiences, it's helped me. And if I can get my patients to sort of come along this road and understand that, then they start to change. Their responses change, and they're less likely to get that terrible persistent pain problem where the neurological system just creates pain for you for very little contribution from your body tissues, and that we call that sensitization. When pain persists, it takes a lot less contribution from the physical component to produce the same pain, and sometimes no contribution at all, and people remain in pain. The injury could have healed years ago, and the pain sticks around. So I think it's really important to understand that this is a multifactorial situation all the time. in the acute phase and also in the chronic phase.
Wow. So that's, in other words, say you hurt your back and, you've got a mechanical problem there, and you have then a chronic, after a while that develops into a chronic pain pathway. So your body's sending these signals, even though now the back is actually healed, but you're still receiving the signals. Is it like almost a habit that the body's got into, that you've, just like with habits that you do, the first time you do it, it takes quite a high threshold to actually do the action that you're wanting to take. And then you do it every day and it gets easier and easier and easier. Is it the same sort of thing that's going on with pain pathways, that it becomes just very easy to trigger that pain if you've had that very often or persistently?
Yeah, absolutely. But not only is that the case, but it's inevitable. There's some really interesting work done where we've looked at the way that the nerves behave, the nerve pathways behave. And this sensitization, is quite a real thing. We know what happens at the neurotransmitter level. But essentially, for us to understand is your brain just develops a direct channel to that area, and any tiny contribution starts to get amplified. It's like having a little noise next to a big amplifier. And this just gets stuck. There are certain medications we can use to help people as a circuit breaker for that, but the medications are not really the treatment. The treatment are to develop other habits and other practices that help you change that pathway and desensitize it. So it becomes sensitized. You need to aim to desensitize it, and there are ways of achieving that.
Wow. So, I'll give you an example. I recently went through shingles, bloody awful thing. Don't recommend anyone getting that. I would have, during the day, I would have pain, but I could handle the pain. At nighttime, I was just like beside myself. Sometimes the pain was just so bad, and it would, I'd be unable to sleep and unable to, do anything. I was in such bad state. I would get up in the night often and go and have a nice cold shower on the affected area, and that gave temporary relief for about 10-15 minutes. And my thinking was, and I don't know if this is right, but this is just me being a biohacker who's always testing things out, broke the circuit of that pain, because then I was focusing in on the freezing cold, and it seemed to stop the pain for a little while, and then it would come back after a half an hour, but I'd get sort of a half an hour reprieve. It could be because of the cortisol response that I've just caused and the adrenaline response from the cold water. I'm not sure what's going on there, but it was effective, and it did help me at least temporarily get on top of it. And my thinking was I didn't want to have painkiller after painkiller after painkiller, and they weren't working anyway, with this sort of a nerve pain. Was that a good intuitive thing to be doing?
Absolutely. Look, you've touched on a few things there. I hope I remember them. But the first one was the concept, the role of distraction, and that's a real thing. One of the problems at nighttime is that we lack distraction, and so there's often a higher pain experience at night. That's quite common. That also leads to sleep disturbance, and we know that the more fatigued we get, that's also a negative contribution to our pain conditions. So there's a whole lot of things, and persistent pain itself will fuel itself, because the more it sticks around, the more worried we get and the more concerned, and it's just such a horrible experience, as people who've had it know. So it's like a vicious cycle. It just keeps going round and round. So distraction's important. We use that in treatment processes as well. There's a whole lot of probably chemical and hormonal things that are going on, and you correctly mentioned that. But at the end of the day, I think a lot of people will develop a lot of intuitive strategies, just like you have. So that's absolutely right what you said. Very, very important part of treatment, and you can only really explain that by understanding the pain science the way we discussed it before.
So if and you mentioned their neurotransmitters, and I talked briefly there about cortisol and adrenaline. can you, by manipulating the neurotransmitters in play, actually manipulate the pain experience? You know, like the example that you gave of the person who's, you know, going to get run over by a car if they don't get, even though they've got a broken leg, they'll get up and go and they won't feel it because the danger and the adrenaline is running so high that they will take action before they'll actually feel that pain. Is there a way to use that knowledge to help people who are experiencing sort of chronic pain, like manipulating neurotransmitters in that way?
Not sure what you mean by when we change people's behaviors and their conceptualizations and get them to do what I call a readaptive program, then those neurotransmitters will change.
Right.
So that's, I suppose, a natural way of doing it, because the neurotransmitters are very responsive to our thoughts, our actions, in that way. In terms of external manipulations, by giving people medications and drugs.
Yeah, well, not so much that, but, you know, like behaviors like the ice cold shower. So behavioral things that we can do to help, you know, because things like adrenaline do dampen the pain response, or endorphins. Like I know from running that if I've got pain, usually, say I've got a sore leg and I go running, the first 10 minutes will be excruciating. So I've got blisters. That's a really good example, because I had a ton of blisters in my life, right? When you had a break, you'd have the blisters be painful. You'd start running again. The blisters were excruciating. After 10 minutes, you stopped feeling them.
Yeah.
And then I sort of thought that must be the endorphins or something kicking out, and that are actually dampening that pain response, because the mechanical damage is there. It's no different.
Right. That's exactly right. We've got what we call a drug cabinet in our brains.
Brilliant.
So all the medications that we give, I mean, we've got a big problem with prescribing morphine-containing medications, but our brains contain morphine-type chemicals, endorphins and others. So so if we can harness these processes and get our own brains to produce the right chemicals for us, then that's absolutely achievable. One of the problems with that condition called pain sensitization that I mentioned before, and that's when your pain becomes really easily provoked and it's there all the time, and is that it becomes also quite resistant to medication. So I've seen people on absurd doses of medication and all sorts of different medication, and you know, their pain goes from whatever it is, they might say 10 on 10 to 7 on 10. Well, that to me is not what you'd expect from that type of medication. So that pain is resistant, and that's quite common. And so one of the problems in that situation, if you go and see the people who just keep giving you different medications all the time, and they're not twigging onto the fact that your pain's actually resistant, then that takes you down a road that's not helpful for you for quite a while, and it's hard to come back.
Yeah, and it's very bad for your, you know, like we know the consequences of the opioid addictions. We hear what's happened, especially in America, with the overprescription of opioid medications, and they all have knock-on effects. Even the anti-inflammatories that you buy over the counter are going to impact your liver and, you know, your health of your body in general over time, your gut health. So that's not a path we want to be staying on for very long. And so anything that we can do, but, you know, having been through like this recent experience with the shingles, you know, it puts, it makes you very compassionate for people that are going through chronic pain for years on end. It's just like, you know, it's hardly worth living when you're in that much pain, and you can see how people must be struggling to cope and function. And when it goes on for a long time as well, then the people in your environment become numb to you moaning about it. You know, there's another aspect as well, because, you know, hearing about you and your pain every day is, they're not, you know, people are just going to stop responding, and that makes the whole load even worse, because then you've got no outlet to, you know, voice your discomfort that you're going through. Is that a real thing too? Do you see that?
Absolutely. Look, as I said before, there's so many vicious cycles in pain, and that's one of them. I think one of the problems with pain, is that please don't take this wrong, but it's not sexy. That's the way I describe it. Like if you've got something else like a diabetes or some other sort of chronic disorder, then I think the compassion you get and the empathy you get from people is pretty endless. But if you've got pain, it's very limited. And you get a lot of social breakdown. Marriages, families break down regularly. Your community starts to judge you. You feel judged.
Yep.
The workplace becomes a very toxic relationship often. And so all these things just feed back into the monster. And
you're less able to cope too. I mean, like when you're in pain, you're irritable, shitty. You're not a nice person to be around. I'm not. When I'm in pain, it's like I'm a bear with a sore tooth. Literally. And that, then the other people suffer. Your family members suffer. Your colleagues suffer because you're not on your A game, and you're taking it out on them if you're not, handling it well. And so these are all conversations, and I think the fact that it's not a sexy topic is that should be, because it's one that hits so many people, and in fact will hit us all at some point in our lives. We're all going to have some sort of pain to deal with, and if there's ways that we can learn to cope with it better that aren't medications, because yes, we've got that to fall back on, but it really should be a fallback option, not a thing that you want to do for long, and not the only option. What's your take then on things like meditation and things that are going to calm the nervous system and, stimulating the parasympathetic nervous system state and all of that sort of good stuff? Do you think this has a role to play in this program of dealing, the things that you can do that are in your toolbox to deal with pain?
Yeah, look, these things are pivotal, and the great thing is that they're not, that they're quite mainstream now. I'm at least pleased that the medical profession, at least here in Australia, has taken these things on as mainstream interventions. They're absolutely pivotal in what I call readaptive programs to get people back. I even know there's an orthopedic surgeon in Melbourne who gets all his patients to do mindfulness before he operates on them, which I think is terrific.
Wonderful. That's wonderful.
So it's starting to become quite mainstream. And look, again, if we just keep conceptualizing pain as being related to physical injury and damage, then none of this makes sense. But if we understand pain as a protective mechanism, and we have to get people to readapt, both in terms of calming down the nervous system with these sorts of techniques. And there's a lot of different aspects. There's cognitive behavioral therapy, acceptance therapy, and what people will, what I find is that people relate to different things. So some people, one modality will be super beneficial, and others it won't. And so you have to find I think, an individualized program for people, which makes it a little bit hard because the medical system doesn't like that individualization yet, but I hope that'll change.
Yeah.
So I think things like that are really important. And then I come back to my roots as a sports and exercise physician, because exercise rehabilitation is really important. You got to get people to understand that the pain they're feeling doesn't equal harm, and they need to progress through it. Now, if the exercises hurt them, then that's a problem, and we need to think about that and know how to address that. So we tend to have this program called a graded exposure program. But you can't sit around doing nothing. You can't keep protecting yourself from pain, because that won't work. That'll just make you worse. So to me, the answer is a program where you educate people, get them to understand how this all works. And that's not easy because everyone learns differently. But if you can achieve that, then that's the foundation. Then the next bit is to use some of these psychological techniques, talk therapies, I suppose we call them, to help give people practices to do, like meditation, mindfulness, yoga, all sorts of things, CBT, etc. And then I think the next really important phase is to get them to do exercise in a way that's individualized for them. Respect pain flares, but get people to understand how to manage them, and then gradually get people back to normal. The mantra of the the pain revolution is to rethink, re-engage, and recover. So recovery is very much back on the table. One thing that happens in chronic pain, persistent pain, is that people very commonly get told, based upon all the things we've been doing in the past, which really haven't been aligned with this type of science, they get told that you have to learn to live with your pain.
Yeah.
Now, if you've got chronic pain and someone tells you have to learn to live with your pain, that can help a lot of people. Don't get me wrong, because that's an acceptance thing and it might actually help them. But for a lot of people, I think that message is not optimal. Okay, because through these programs, through neuroplasticity, bioplasticity, which is that wonderful adaptability of the human body and brain, we can get a lot of these people back. And so I don't like people believing that if it's not necessary.
Yeah, and I totally agree with that. And that's I think that in general in the medical world, my background, which you don't know, but my listeners know, I had a mum with a massive brain injury from an aneurysm, and we were told like she'd never do anything. She was in a not much over a vegetative state, aged 74, massive brain damage. Put her in a home, make her comfortable, and for a start, I don't do comfortable because I think comfortable is the way down, and that life, we need goals, we need to push through struggles, we need to, go through a certain amount of pain in order to come out the other side, is my premise as an athlete, if you like. And understand the benefits of going through, like physical pain as far as training pain goes in order to get stronger, right? So I understand that sort of principle in biology. And for me, it was like no different. So with mum being told that she couldn't, just accept it, I didn't. And it took me 2.5 years and thousands of hours of research and retraining her brain and hyperbaric oxygen therapy and everything else that everyone's heard me preach about on this show many times. But it took me 2.5 years to get it back to full health again, like complete full health. And so I don't accept when someone says, you can't do something, or you just have to accept that this is your lot and that's the end of the road and this is all we can do. No, that just means that doctor or that person doesn't know what else they can do. They don't know. And that's fine. Go and find someone else, because someone else may have a different perspective on that. Go and research, find other ways around the obstacles, rather than just going, oh, that's just me done, then that's all I've got, because I think very often we're written off as that's the end of the road. And when you go to a doctor, and they are the ones that went to medical school, they're the ones with the big brain, they're the ones with education, you tend to go, okay, they know what they're talking about, and that's it, and to accept that. Whereas my thing is that maybe that person just doesn't know all of the things that are out there, and maybe that person's super busy and they got 10 minutes to spend with you and they haven't got time to take you through a rehabilitation process. As you said, with what you do, it's a education, it's rehab, it's all these things that are extremely time intensive. Now, most people in the standard medical care don't have time for that sort of thing or the resources. And so therefore it's up to us as individuals to start taking control and doing the research, finding people, and doing this all ourselves to the best of our ability if we want to come out the other side. That's sort of the premise of the show, and why I get to interview, amazing people like yourself that have pieces of the solution for people, and so that they can, oh, that's interesting, I might go and research what Dr. Kal said there and go and visit his website, and maybe that will help me. And that's, I think, a very empowering standpoint to come from, rather than it's all over and there's no chance and you've got this. Would you agree with that?
Largely, absolutely. Look, science is about questioning. It's not about accepting. I think science is wonderful. That's really where I look to for answers. But it's about questioning, not accepting. I think one of the problems that's happened in sort of mainstream medicine and perhaps the health industry to a large extent is that we've started to accept too much. We're not questioning enough. So for example, if you go and see someone, they'll give you diagnostic comments and prognostic, which is like predictions of the future comments, based upon things that were done previously. Okay.
Mm.
Now, I can tell you that in this field of medicine, and there's a lot of crossovers to other areas of medicine too, this area, the biopsychosocial model of care, we call it, and the fundamental role of the brain and the nervous system in our biological processes hasn't been addressed anywhere near adequately in the last 10, 20, 30 years. So the opinions that we offer and the predictions we offer are based upon a whole period of time where we haven't been recognizing this incredibly important part of health.
Yes, totally agree.
Okay?
Mm.
So it's not that it's so I think, you know, I think people do have to question and look for other possibilities. Now that you've got to be a little bit careful with that too, because there are so many snake oil salesmen out there.
Oh, God, yes. Yeah.
So I think the answer has to still be in science.
Yes.
But then you also have to know how to interpret the science, because, you know, there's a lot of things in the research that are not optimal. There's conflicts of interest and all sorts of things. So you have to be a little bit careful how you interpret that stuff. So look, this isn't easy, to be honest, but I think the key thing is to not give up hope, keep questioning, and understand that there are things that can be achieved by harnessing this plasticity concept that we're talking about. I think quite often, and I say this with a heavy heart, the people who do well in things like pain or recovery from injuries are often the people who have elected not to listen to the things they've been told. And they've just sort of fired ahead regardless.
Yeah,
and we know of lots of examples like that, and your mother seems to be one as well. So
yeah, she is, and it's not a factor of like ignoring medical advice. That's not what I'm saying here. It's just go and get a second, third, fourth opinion. Go and do some research. Go and listen to some top podcasts, some professors. Go to PubMed, and it isn't easy. It isn't easy, you know. Like in this journey with Mum, and on other journeys, because that's what I do now, is help other people on their, you know, difficult health journeys and stuff, and connecting people and so on. It isn't an easy thing, and I've run up a number of dead ends, you know, and I've wasted money, and I've, you know, gone down paths that lead nowhere. But by the same token, there were a number that did lead to places that are not being fully recognized, you know, like things like hyperbaric oxygen therapy. Like, for me, in my opinion, is like a totally underrated, undervalued therapy that could be doing a heck of a lot more, but there's no money in it. There's no one's going to be promoting it hugely, as far as, you know, there's no pharmaceutical company behind it. They can't do anything with it in that sense. So it's always going to have a limited. So all I can do is bang my drum about it and teach about it and point to the doctors and the resources and the books and stuff for people that have had success with that. And I think it's the same with pain and the whole pain. Well, we're starting to understand that neuroplasticity, that the brain and the body and the connection between the brain and the body is just an area that we need a lot more science in. And it's not always, you know, like a physical thing. Like going back to what we were talking about at the beginning, if someone comes to me and they've got a sore back, you may be looking at the back situation, or you may be looking at what's their inflammation markers doing in their body, what's their gut health like. Is the fact that they've got a sore back a signal that maybe the nerves are not turned on? You know, can we activate? You know, there's in other words, there's other directions to be looking in. It might not be a mechanical back issue. It could be something on the front end, the gut or the digestion or the whatever the case may be in that situation. So sometimes it's like looking outside what you normally would think is the problem area. Is also a really good holistic, so that holistic sort of a viewpoint. Let's not just look at the back pain. And this is another thing with medical, the standard sort of medical system, where the body is broken up into areas or specialties, and rightly so in a lot of ways, because you can't be an expert in lungs and heart and gut and so on. But there needs to be more connection between somebody who's looking at the whole the whole picture and piecing this all together for the person. Because I mean, the lungs and the heart, you know, that's a really good example. They're very interconnected, but they're completely separate disciplines that don't really talk to each other. And I think, you know, more integratedness in their approach would be good, if that's a proper word.
I think it's integration. It doesn't matter.
Yeah, that's right.
Look, I think there's a lot in that as well. I think the key thing is that to try and avoid being too passive in your own health, because reliance on external fixes can be a problem, but a lot can be achieved by energy, by lifestyle changes. Now, these days, unfortunately, I think there's this trend towards outsourcing your problems rather than
magic pill.
I talk to my patients about the long game versus the short game, and it's the long game that wins. So yes, try and be more active in your own health, and question and ask, but I think we do need to put a little disclaimer here that there is need for caution here as well, like I said before, because there are a lot of now some of those treatments I think fall into what is commonly called the placebo category, which to me that's a fascinating area of neurobiology, just the way that the placebo construct operates. And it's like, if for people who don't understand, it's like when you get the sugar tablet, it's got no properties at all, and yet you still get the same response as if you had the real tablet.
Fascinating.
But it's the expectation and the belief that dictates that response, which again comes right back to the neurobiology and the role of the brain. It's not the sugar tablet that does that. So I think some of these things operate through a placebo construct. Now, I have no problem with the placebo. I think it's fantastic. In fact, there's some fascinating work being done in that area about how we should harness that in a constructive way. But there are safety issues with the placebo construct approach. So, for example, if you keep resorting to that approach, then the benefits wane with repetition and time. And then what happens is you tend to go to a more aggressive type of intervention and perhaps more dangers. And so that can be a problem in that direction. There's some fascinating research in the last 10 or 15 years, which is showing us that some of the very common surgeries that we've been using or we've been thinking are incredibly effective, have had when they've been looked at against a fake surgery comparison, and these things are done, then the results were exactly the same. So even
that in the knees
even knee arthroscopy is one, and there's others as well. So even surgery can fit into this placebo construct, and I don't think anyone would think that surgery is entirely safe. So we've got to be careful with that type of approach. So I think we do need to apply really, really good quality scientific approaches to this and get the data out and understand what works directly and what works indirectly, and the benefits and the safety problems, et cetera, et cetera. And I think unfortunately this means that the patient or the person with the problem has to really be quite active in their own management.
Yeah, and I think that's probably the biggest takeaway from all this is, I think we grow up with this mentality. When you're sick, you go to the doctor, you get a pill, and you come right. And that mentality is just very, very flawed in the fact that it often takes work. It often takes lifestyle interventions, which, to quote you, is a very unsexy thing for me to tell you to go and do some more exercise and eat less fish and chips. You're like, I don't want to do that. Just give me the pill to fix it. Is often the answer, and it's not that no amount of just taking a pill it's not getting to the core of the problem, depending on what the situation is, obviously. But lifestyle interventions and behavioral changes are things that we should be grabbing to first before we resort to the more medications and things where appropriate. And that's a conversation that needs to be had. It isn't just about going to the doctor, because people sort of, I think too, expect to get a prescription when they come away from the doctor. If I didn't get a prescription, then that was a waste of time. I went to the doctor, I paid him X amount of dollars, and I didn't get a prescription. I got told to do some more exercise and lose some weight or eat better, and go to sleep earlier. It's like, well, where's my pill approach? And I think if people understood biology a little bit and understanding why, that may help your back pain or your whatever the case is. That'll be a better conversation. If I can just flip and just say, well, what do you do so then at the Pain Revolution? If someone is dealing with chronic long-term pain who's listening to this, how can they come to you, get support, get help around this education process and this, what exactly is it that you do there?
Yeah, look, that's obviously the pivotal question. The Pain Revolution approach is pretty much along the lines of what I was talking about before, that the first thing is to really understand how this all works. And that is a major challenge, because one of the biggest things that we've looked at is how people learn, because everyone learns differently. So that is actually a really big conversation, the whole conversation about education and health literacy, pain literacy. But unless you can achieve that to a certain extent, the rest becomes very difficult. So that's important. So the rethink part of the mantra of rethink, re-engage, recover is really, really important. Now, to do that, the person who started the Pain Revolution is a fellow called Lorimer Moseley, Professor Lorimer Moseley. He wrote.
Yes,
he wrote
I
a
know.
book. Have you heard of him?
Yes, yes.
You should get him on your podcast one day.
Oh, do you know him? Can you hook me up?
I do know. I can inquire, but he's a lot more entertaining than I am, and certainly a lot better at this, at explaining it. But he wrote a book called Explain Pain with another fellow called Dave Butler. He's also an excellent person. And so Lorimer just wanted to do something practical to create a program that people could harness. And so he came up with the idea of the Pain Revolution. I got on board very early. We do an annual outreach event, which is a cycling tour, and we go and give presentations in all different country towns along the way.
Wow.
And this year, of course, we couldn't do it because of COVID. We're doing an online thing, which is starting in October. And it's all about raising funds for this program, which is there's a course, a 2-year course for what we call local pain educators, where we take people from all sorts of disciplines, doctors, physios, psychologists, occupational therapists, pharmacists. There's probably a few more that I haven't mentioned. And anyone who's interested gets on this program, goes through the program with mentors, and comes out the other end. And then the next wave is what we call a local pain collective, where those people start to talk to the other people in their communities, health professionals, people with pain. And so we're hoping to create a ripple of. Now, we're only about 4 or 5 years into this, and so it's got a long way to run, but it really is starting to gain ground, and I'm very proud of it. It's very much focused on non-interventional techniques. It's not to say that pharmacies and interventions don't have a role, but I think that high reliance on those things to create an outcome isn't working for us.
No.
And in fact, it's creating a whole lot of other issues. So this is very much focused on a neuroplasticity type approach, a readaptive program to get people back to normal as much as possible. Now, the structure of that, I think, as I said before, can vary from person to person. So I encourage people to explore all the different resources. There's website resources. There's certain programs that have come out of the Pain Revolution. I'm involved with a few of them. I'm involved with one called Brain Changer, which has a website as well, which is a program put together by a lady called Tina McIntosh, who is a recovered persistent chronic pain person herself. And she's put together an app and a computerized program to help people practically.
Wow.
And again, there's some pain coaches in that. There's one I have only been involved with in a sort of advisory capacity called Permission to Move, by a fellow called Dave Moen, who's also got some terrific approaches and some website resources. And I've just noticed this is exploding, which is really encouraging, because when I started doing this, I felt like a lone voice in the wilderness. But now there's so many terrific programs coming out all over the world along this direction. And it's all about empowering people and getting people to start mapping out their own recoveries.
This is just marvelous. And I just love this sort of approach, that I think, yeah, pharmaceutical interventions when they're required, but not just relying on that, and let's re-educate and retrain and help with other things. So that's fantastic. So I hope that lots of people will go and visit. And I'll get all of the links from you to all of those that you've mentioned, perhaps, and we can put those in the show notes to help further this conversation and to give people, because there's so many people suffering various levels of persistent chronic pain with different disabilities that are, and it wrecks your life. It does. It just takes away your joy from living. And if we can help people with this conversation today, I think, get people interested, and perhaps this is something for me that could help me with my journey, and also in the education space. And this is what I'm passionate about, educating people about the different areas. And so it's been marvelous to have you on the show, Kal. I think I'm really, really grateful for our mutual friend Craig Harper for introducing us. Shout out to Craig. And just really grateful for your time and your passion that you're bringing to this, because there's lots of people suffering out there, and if we can help them in any way, that's really, really important. So any last words before we wrap up there, Kal, and that you want people to think about or to do?
Oh, last words. These are supposed to be really wise words, aren't they? They're supposed to...
You always put people on the spot in the end, it's like, I just told you a whole hour of stuff.
Look, I just think, just reiterating that there's real potential for recovery now. Now, certainly there are some conditions which are exceptions, and we have to respect that. But to the great majority of people in chronic pain, from musculoskeletal issues like bad backs, bad necks, various injuries they've had, there's enormous potential for recovery. If all these things that we see on scans were painful, I've got to tell you, we'd all be in agony. The reality is that most of them are well adapted. And so, and there wouldn't be things like sport if there was a linear relationship between body damage and pain. We wouldn't have things like sport, because we'd all be in too much agony.
Wow.
So the reality is that the vast majority of these things are well adapted, and that's what you should aim for. If you've got an injury, if you've got a problem, you just need to create that adaptation pathway for yourself, which doesn't just involve the injury. The injury can do that. We know it can do that, but it also involves the neurological system, the brain, and that is where all these types of aspects come into play.
That's absolutely wonderful. Dr. Kal Fried, you've been amazing today. Thank you so much for your time, and I really, really appreciate the work.
Thank you for having me. I appreciate you asking me to come on.